Hey everyone, the Morning Line. Nick Barris here, and on Wednesday, Clint Kelly. He's a malpractice attorney. We can take your phone call, 737-7587. Had any cases lately where someone left like a sponge in someone, or a tool, or maybe the surgeon was eating junior mints and a junior mint fell in?
I have not had a junior mint.
Remember that from the Seinfeld episode?
Seinfeld, yes. Have not had a junior mint case in some time. But,
okay, yeah. So every once in a while, some weird ones come along.
They do, and you know, that's what's great about each new year. It's what's great why they call it a practice. You get to learn these new types of cases.
Things coming through the door. Listen, we got Joe on line one. Good morning, Joe.
Good morning, Nick.
Hey, how are you? Happy New Year.
All right.
Happy New Year, Joe.
Glad Mr. Kelly's on again. A brief question here. I was watching on the national news where this gentleman had surgery, and I believe it was maybe 8 or 10 years had passed, and he had pain, but he thought it was just something, you know, had to do with the surgery, but no big deal. But he finally had an X-ray. They had left a surgical clamp in this gentleman for about 8 or 10 years before he found out that was what was causing his pain. What kind of ramifications would he have on getting any settlement on something like that?
Well, he definitely has a claim, and because it's a foreign object in Tennessee, the statute of limitations is told or stopped. The clock doesn't run until you discover that object is in your body. So he still has all of his rights, if it were a Tennessee case, to bring his claim. The question you have to ask yourself is, obviously he needs to get rid of the clamp if that's the cause of the pain.
Right.
So the question you ask is, how much would the surgery cost? What type of risk of infection or bleeding or that sort of thing would be incurred to get the clamp out? And what type of pain and suffering would he have to go through in order to get through the surgery and the convalescence? And that'll give you some idea what the claim's worth. Okay,
but that, again, statute of limitations starts the moment you discover that was, so it could have been 10 years ago. He discovers it a decade later.
Correct.
Right then.
And, you know, what Joe saw on TV, it actually happens more than you think, Nick. It's just a lot of times those cases don't even wind up in court because the hospital or the doctor will make a really quick settlement before it becomes public.
All right, I'm just curious, and you've got the insight into sometimes what happens in OR. There's clamps, they're doing a surgery, all this stuff works out. Whose job is it to remove the clamps after the delicate procedure is done? I'm guessing the doctor maybe does that surgery, sutures things up or whatever, and he's like, okay. Whose job is it to unclamp the vessels, or to remove the sponges, or to snip off the excess sutures?
That's a great question. It's called a count. That is the responsibility of the nurses to do a count. Now, legally, the doctor shares responsibility because the doctor is in control of the surgery.
Okay.
And so the doctor has some shared responsibility, legal responsibility, to make sure that the count is correct. But that is, my understanding, delegated to the nurses to make sure that is done properly. That it goes for clamps, sponges, you name it, to make sure we get all the equipment out before we close up. And surprisingly, there are quite a few situations where it doesn't happen.
Oh, and when you say count, meaning that they've got a count of everything that's in there, and then they 1, 2, 3 make sure they're all there and say, wait a second, we had 10 and there's only 9 here.
Yeah. Sponges. That's another example where they put sponges in to wick up blood, and they leave sponges in the patient's body because they had, let's say, started out with 5 and they only pulled out 4.
Yeah.
Or with scissors, call them hemostats. They started out with 2, only got 1 out. And you know, I've been telling you, Nick, that as we have more and more procedures done in shorter amounts of time, these types of mistakes are going to continue to grow.
That's what you say. I'm just curious, in your career, have you, under any circumstance, had an opportunity to sit in on a surgery or watch one from above, or would you have ever wanted to, just to see how procedures go? I know you can go online and do your research. I'm just curious.
I have not, and I don't really think I need to now because I can go to YouTube and see almost every single surgery that's done. And if it's a surgery that I need to show to a jury, it's pretty easy to download those and have an expert explain the procedure, as long as you don't give up the patient's name.
Right. Interesting. All right, let's go to Terry. Terry, good morning. Hello, Terry.
Yes.
Hi, how are you? What's your question, sir?
Yes, I had a fall back in February.
Okay.
And ended up dislocating my shoulder and breaking the bone that runs from your shoulder down to your elbow.
Ouch.
And they ended up putting screws and plates in. my question, I've been having trouble with this since then, and I ended up going to another orthopedic, and he done a CAT scan on it, and said when the doctor that done the emergency surgery set my shoulder back in place, it wasn't straight, and now it's done growth where it's crooked. Is there a claim there?
Potentially. Have you been given an opinion as to what type of surgical option you would have to fix this?
He said there's nothing surgical. This other orthopedic said there was nothing surgical he could do to fix it.
Well, Terry, two things. First of all, you might indeed have a legal claim if the setting or reduction of the original fracture was not handled properly, and that's proven to be a deviation from the standard of care. You would have a claim because clearly you have an injury. What I would also do, Terry, if I were you, I might get one more opinion to make sure that you're that there are no surgical options for you, because it's usually pretty regular that when there is what I call a bad orthopedic outcome, that there can be some type of operative remedy to make it better. I don't know about your case in particular, but I think I'd get a second opinion on that just to make sure. But yeah, you might have a claim, Terry, and you're within the year because it's not February yet.
Yeah, all right. Do you want...
Yeah, absolutely.
Terry, yeah, listen, Terry, the phone number, we'll have Clint's number up at the end of the program. Stay tuned for that. And yeah, Mary can put it up right now, as a matter of fact. If you want to get a pen and paper, Terry, the number there is 824-3703, and we'll have it up again. I know you may not have had a pen and paper with you now, but Clint, explain what it is when someone makes a call to your office.
Well, I was going to say, Terry, as you asked for Nurse Kathy, I have a nurse consultant who is affiliated with our firm. She takes all of our medical negligence calls, and what I encourage the public to do is when they call, tell her, look, this just what Terry did. Here's what happened. In February, I had this procedure. It didn't go right. Now I've got, it looks like in this particular case, I've got an anatomically bad result. I need to know whether or not I have a case. A lot of times she can do the interview and then contact me and say, Clint, this case is worthy to go forward, and get a medical expert to look at, or she'll say, hey, I don't think this is a case. But ultimately, I do the final review. I look at the report that she generates, and I make my decision from a legal standpoint whether the case is worth going forward. But it costs nothing to pick up the phone and call and speak to Nurse Kathy, and it would never cost the patient anything unless there is a recovery by me. Until I get paid, the patient doesn't have to pay anything.
Yeah, meaning it's you get paid on contingency. It's not a retainer.
Exactly.
So, and again, as you said, ultimately what will determine whether or not Terry maybe has a case, once you get the details, is if you can show that that original doctor did not abide by the standard of care that would be used to correct an injury like that.
Right.
And we don't know. Maybe he did, and this is just the way it grew.
You know,
but
Nick, orthopedic cases are like carpentry in the sense that there's a lot of hammering, a lot of nailing, a lot of screwing, a lot, to get everything to look right. And, there are occasions where it's done very, very badly and patients have claims. But my experience has been it's difficult to prove these cases because there is a lot of variation in what the surgeons are allowed to do. They're given let's just say they're given wide latitude to decide their approach. Sometimes you get a bad outcome even though the approach is reasonable. So you always have to keep in mind, was the approach and the procedure itself reasonable, not necessarily whether there was a bad outcome.
Gotcha. All right, let's go next to David. David, good morning.
Good morning.
Hi, David. How can we help you?
In November, I had my lower bowel removed, and 2 weeks later, I developed a surgical abscess that necessitated a trip to the emergency room and then an ambulance ride to Nashville back to the hospital where it was done originally. I'm wondering if I might be able to claim the cost of the ER and the ambulance ride to the original hospital.
Okay. That's a good question, David. I had a family member that had a lower bowel surgery. It wasn't a complete removal, but it was a portion of it was removed. She had an abscess, almost died from it.
Yeah.
And I learned a lot about abscesses in the context of bowel surgery, and unfortunately, these are potential complications that even the best of medical care doesn't necessarily prevent an abscess. Now, David may have a case if there is some type of negligence in the way the surgery was handled, or if there were signs of infection before David got out of the hospital that could have been treated or prevented before this became a real issue for him. But I just tell everybody that when you have bowel surgery, abscesses are one of those complications that are risks of the procedure that patients just have to simply assume, because anytime you're working in that particular area, high chance of infection.
Yeah, high bacterial count. So in terms of when you say whether he had a case, that would be dictate whether or not he could get reimbursed for these transportation costs and all of that.
Correct. And you know, David survived. I know it sounds to David that may not be a, hey, thanks a lot, man, you don't know what I went through,
right,
kind of thing. But people die from this.
Yeah.
Like I said, one of my relatives just almost died from this, and so it's a very serious thing. The key about an abscess in the lower bowel is to get it treated as soon as possible, and not wait too long before, as we've said before, a campfire turns into a forest fire.
So what should he do then, maybe, if he just wants to explore that?
I would. He can call and ask to speak to Nurse Kathy.
Okay.
I do want him to call my office and make sure, because that's what you need to do.
Okay.
I'm just kind of giving maybe just a sort of rough-hand preview of this type of case.
Well, yeah,
I've
you've seen it before.
I have.
All right. Yeah, so we'll have the phone number for Clint up at the end of the program, so stay tuned for that. We've got several calls actually on hold for you, Clint, so we'll take a break. We'll be back with more right after this. Stay with us.